I'm Dr. Goldenberg. I'm one of the trauma surgeons at Cooper. I'm also the trauma research director there. I've been there as a fellow. I finished in 2015, and I've been there for almost 10 years. The ASSET course is, basically standard for all trauma surgical exposure, difficult trauma exposure that we see very often in the United States. But in Israel, it's a common misconception that they're a violent country. They're really not. It's nothing like we see here in America with the gun epidemic. In terms of actual casualties, they've never had an incident like October 7th where hospitals were just so overrun with casualties. Many of the trauma surgeons, which there are not very many officially trained trauma surgeons in Israel, had wanted the course to come there but didn't know how to facilitate it, didn't really know how to do it. And I said, hey, I have this really, really great idea, but I don't know how to do it financially. The funding for the first trip was majority of Federation and some, private donors and personal friends and family. And then the second course is fully funded by the Federation. The surgeons that came to the course were so just in awe that people in America would care enough to bring them education. They felt such support and they were so thankful after the course. They were like, wow, we learned so much. This would have never been possible. It would have never happened. Collaborating with Israel as medical professionals is going to just help so many more people there. It's going to save soldiers. It's going to save, God forbid, civilians. We went into it with that mentality, and I think the Federation really believed it and supported the mission.